welcome to our today's podcast on Voluntary Male Medical Circumcision or VMMC. My name is Noko Morakaladi, your clinical nurse specialist, your health marshal from TUT Health and Wellness. Today, I'm your host. VMMC is one of the proven strategies to preventing HIV and AIDS. However, young people still have questions around VMMC. Today, we have got our expert from Right to Care, Mr. Floyd Motsweni. Mr. Floyd Motsweni, welcome. And we have got our three vibrant peer educators who are going to be asking those questions that they've always had questions to about VMMC. You can feel free and let us discuss this sensitive matter, and welcome. So, Thabang, let us start by you. Is there any question that you want to ask to our expert today?
Yeah, I have like a simple question though. We have been forced, like at home they say you gotta circumcise, but like I don't actually get like what is it like VMMC? What is it like?
Okay, thank you so much, Thabang. Firstly, we must just break it down when we are talking about medical male circumcision. So when we add that V, it's called Voluntary Medical Male Circumcision, meaning VMMC. We have to break it down. There's three types of circumcision. One, there is the traditional initiation. The second one, there is this one, it's called religious circumcision. Religious, there are circumcisions that are done due to religious purposes from the Muslims and the Jews. Within 7 days, you have to circumcise. And there's this one, which is called voluntary medical male circumcision. So this one, it's a circumcision that is done by health professionals in health sterilized facilities. The one which is done in the clinics. So circumcision that we are here to discuss about is the one that is done at health facilities, done by health professionals in sterile environment. That is the difference between the types of circumcisions that we have. I have to make a disclaimer though, there is nothing wrong with these three types of circumcisions. Whether you come from which cultural background, all of them, they are good enough, they are sufficient for us to do. It's your choice. But today, for the purpose of today, we are discussing about voluntary medical male circumcision.
Oh, thank you so much, sir, for such a deliberate answer. You have elaborated enough. I think we have got rights as the citizens, and as he has already put out the disclaimer, none is better than the other. For the purpose of today, because we are the Directorate of Health and Wellness, as he has put it, we are discussing the VMMC. Thank you so much once more. So let's move to you, Mangoba. Is there any concern that you are having around this issue of VMMC?
Oh yes. Firstly, welcome to Clinic here to TUT. I'm a peer educator, Lana Arts Campus. I'm doing my second year. And I guess for me, hence you highlighted the three forms of circumcision. Why is it important to young people be circumcised, especially as cutting samaj?
Okay. Medical male circumcision, we have to explain it this way. It's a removal of the foreskin by qualified health professionals in a sterile environment. So, what I've said, why must we remove this foreskin? That is the main question. We must remember that the foreskin is the excess skin on the male private part. That skin that is elongated, that's covering what we call the urethra. But in our language, it covers the head. Yeah, polo neck. We can call it whatever we call it. So we need to ask ourselves, why must we remove that polo neck, that excess skin? We must remember that excess skin, it's a receptor. It carries things. What things am I talking about? You must remember, if that head is covered, there is moisture in there, Anything that is wet, what does it do? It attracts dust. Anything that is there is going to do what? It's going to stick. So when it sticks, why do we need those things that stick? We don't want them there. That is the entry point for us scientific people. It captures viruses, it captures bacteria, and other foreign objects. Those objects, we don't want them in our body. And through this topic, mostly that we are worried about is, in the SADC region, is HIV and AIDS. So that is the part where all these STIs, HIV and AIDS, they enter through a male sexual reproductive organ. Removing that foreskin, you remove that risk of those foreign objects to enter your body through your private part.
Wow, thank you for breaking it down just like that. So guys, it means circumcision is just not more than just a cultural practice. It's a public health intervention with proven benefits as you have outlined them. Thank you for that one. And to you, cousin, do you have anything to say?
Yes, thank you for the chance. My name is Mpelelisi. I'm a second-year student here at TUT and a peer educator. My question is, are there any advantages and disadvantages of circumcising?
Yes, we hear stories of people going to mountains and not coming back, or people having, the clinicians will tell you, an adverse event. An adverse event is when there are repercussions of what you have done that you did not expect. Firstly, I would like to say, when you go and you circumcise medically, you are going to have a chat with a clinician that will explain to you the benefits and also the risks that are involved with medical male circumcision. Yes, the most common benefits of circumcision, it reduces up to 60% of a man contracting HIV from a female partner. The second one, prevention of STIs. Some STIs, not all of them, what we call ulcerative STIs, STIs you get from the skin. That's why it says ulcerative. There are other benefits like hygiene. You know, if a person is not circumcised, that thing, we call it the magma. The magma that is inside there, it smells, you know, the pap inside. Yeah, once you are circumcised, it doesn't smell. And risk of human papilloma virus. What is human papilloma virus? It's a virus that attaches itself on the skin. And it also, as it during intercourse with a female partner, you can pass through that papilloma virus, which will cause cervical cancer for female partner. Those are some of the benefits, not all, and limited to those. Those are the common ones. The risks to what you have answered. There is a risk of bleeding, those adverse events when you have infections after circumcisions. The biggest one for Renamajita, you know, we are scared. Okay? For that part, we are scared of the pain. Okay? Yes, so it's one of those are the major ones. So, medical male circumcision, as I've explained it, is done by professionals, people who went to school. Yes. They are taught about hygiene, you know, to prevent infection control. The sterile environment, where the surgery room, where the procedure is done, it must be sterile. So it addresses the issue of adverse events, those complications after circumcision, bleeding. So bleeding, medical male circumcision, after doing the surgical procedure, remember, you are going to be stitched. They close that part after removing that foreskin. So bleeding is minimal or it doesn't occur. When it's minimal, it means those tiny spots, but you are going to be controlled because you are being bandaged so that to stop that bleeding, so that you can coagulate. So I don't want to go deep. Ke bolela ka minus 4. Yeah. E ra hore fela, just stopping.
Yeah.
Or stop fela. That is one. The pain. So there is before surgery and after surgery. We must break it down.
Yes.
How can nakamo surgery going inside the surgery? You are going to be given an anesthetic. An anesthetic again, a thing that makes you not to feel whatever is going to happen here. When you go to the dentist, does the dentist take pliers and take out your teeth?
No.
What happens? That's the anesthetic that makes you numb.
Yes.
That is the first one. After the procedure, that anesthetic, it will subside. Yeah. What happens? Will I feel pain? And no, it is controlled. You are given pain blocks or Panado, that you are given for a certain period to manage that pain. If it happens. Some people, they don't have pain at all after medical circumcision. Some get minor discomfort, but it will be controlled. But if it happens, or no, you can't take it, you have pain, a serious pain, or as medical people, you are allowed to, when you are at home and you are feeling that discomfort, come back so that we can assist you with this road, circumcision, to be smooth for you. So you have a lot of options. But as I said, the medical male circumcision is in a controlled environment by health professionals. Usually, we don't have those things sterilizing in rather very, 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 very awkward cases. But generally, circumcision is safe. Here in South Africa, we have performed over 5 million medical male circumcision. Wow. That's happened in South Africa.
Wow. So there is no need for one to be left behind, because as you are speaking here, one thing comes to my mind to say the benefits of circumcision actually outweighs the risks. Mm-hmm. Because we as healthcare professionals, we have put measures in place to mitigate those risks. So there is no need for people to be scared of voluntary male medical circumcision, isn't it?
Yes.
So, yes, moving right along, after hearing everything that our good say here has taught us today, let us now reflect. What do you want your young people, your peers, to take away as key messages from today's conversation?
Well, I think for me, intenkulu is in the health, especially as a male. Seeing ukuthi if it's moist with the foreskin, it attracts a lot of STI. It can trap STIs. There's bacteria through dust, and I think I encourage youth ukuthi iyenze circumcision, because I mean, there's religiously, culturally, and through esibhedlela. All of them are practicing one thing that should tell us something. And yeah, so yinto I reflect on.
Yes, wonderful. Yes, and you know, if I would just put that into our public health perspective, we have got a 95 unit strategy in prevention of HIV. And one of the proven methods of preventing HIV is circumcision. So the more males are circumcised, the more we will be able to prevent HIV. So let's move right along.
Yeah. Another thing, when you're circumcised, please avoid like some sexual activities, just like masturbating, looking at naked pictures, because it will hurt, my guy. It won't be easy. So that's what I'm telling you.
I think that is a very good one. So, but then it raises a question in my head to say, then after how long are we expecting recovery?
Okay. So a great point that you have raised there. After circumcision, then all this pain, when bowufanele ukhulume ndoda uthi mawuvukelwa kwenzakalani. So bafowethu, we must know, remember, I said when circumcision, before you go through the procedure, you are going to sit down with a health professional that is going to explain to you after the procedure, how to take care of yourself so that this road, your healing period, it must be smooth. So, quick lessons. After circumcision, after the surgical procedure, healing period is usually 6 periods that is being given. But you know, people's bodies are not the same. There are other people that heal quicker than the others, but it is recommended that within 6 weeks, you should be healed. Saying that, you must know that that 6 period, 6 week period, you are not supposed to have sexual intercourse. That is the first point that you must know. Because superficially, you might look to be fine, but you might find that inside there are other things that are still healing. So we must respect that 6 weeks period. During an erection, after the surgical procedure, maulele, you know, as men, young, healthy men, your peers, you know, 3 o'clock, 4 o'clock, we receive that message from God that, no, you are still a man. You know, you know, it's involuntary. It's just like that to see you are still a man. What happens that time? And you came back to the surgery, what happens? You wake up. When you wake up, to tell that hair today, relax, Baba. What you do, first of all, you must excrete. You must go and make sure that you pee. You don't have anything trapped in your bladder. Go and release. After releasing, you take your cloth. If it's not sleeping, you take your cloth. You just pour cold water on the cloth. What you do, you just put it here. This place, when it's cold, you will not get an erection. What happens if you are in public? You don't have a cloth, there is no toilet closer, but it's painful. What do you do? Yes, you must have a plan B. So the plan B, guys, you just go somewhere where you are private and nobody's watching you. You just go and you just pinch yourself inside on your thighs. You know, guys, your thighs here, they are very sensitive. So if your mind is off, and then it's going to relax. Yeah, that's how it's supposed to be. So there is education for wound care. You are going to sit with a health professional. They will explain to you the day 2 follow-up, the 14-day follow-up, the 6-week follow-up, it's regular check-ups to see how you are going. You can circumcise and go to work. You can live your normal life. So wound care will be given to you by health professional, how to behave, after circumcision, everything that you need at your disposal, you'll get before even finishing the procedure.
Wow.
So ngicela ukubuza lana bhuti wami. So asithi manje you are an active person, umuntu odlala ama sports, ibhola or rugby kanje. So nakhona is it advisable ukuthi uthathe break kancane umhlala phansi and
Great point. We must remember there's a surgical procedure that happened to you. Even though it might be a minor procedure, but it's a procedure, right? So we have to, if you are working, you don't need to take leave from work. You normal as usual. If maybe you have to move from here to there, it's okay. Medical male circumcision doesn't stop you. Ungaya e mall, ungaya e cinema. You can do everything that you do on your daily basis. But for activities that require your physical strength, your well-being, running, sports, those kind of things, we advise that you must remain 7 days, refrain from doing those physical activities like lifting, running, playing soccer for 7 days, and then you can only resume after 7 days. When you are feeling that you are sorted, you are able to. If you are not able to do those things, you need to rest or and then seek for extra advice.
No. Majimbos, it means discipline during this period of healing is key. Otherwise, those benefits might just as well be compromised. So I believe that we have really learned a lot today, and you, to the viewers there, you have learned as well as much as we have learned. We have come. Oh, you wanted to say something?
The only thing that I can say is that to my peers, it's very important to be circumcised. Gents, let's joke, let's
Cut
go and
it.
cut. Yeah,
Cut it.
There's nothing I can say.
Ooh, I just like that moment of pausing in between to say, you know what, gents, let us chop it off. So we heard about the benefits. There is no excuse, guys. And we also, a lot of people would usually say pain. We know how pain, no one wants to have pain, but that, as healthcare professionals, we are able to manage that. You will never ever. So, guys, thank you once more. I am Noko Morakaladi from the Directorate of Health and Wellness, Tshwane University of Technology. Let's, up until next time, be safe. Bye. See you next time.
Easy. Shoboti.